Hello and welcome to this presentation on French acupuncture. My name is Alina Borlogeanu and I'm going to tell you a few words about the style of acupuncture that I practice in. But before I begin, I would really like to take this opportunity and give my heartfelt thanks to Vita Revelli and Dr. Roberto Gatto for their very kind invitation to participate in this Congress amongst amazing acupuncturists and scholars of Chinese medicine. It truly is an honor to be here amongst all of you. Now, let me begin by telling you a few words about myself. I was born and raised in Romania. I came to France in order to do my university studies. And I started off with English studies and then slowly veered towards Asian studies, not sinology, as you might expect. That would have been helpful now, but no, it was Indian studies, lots of Sanskrit and Pali. And soon after that, a friend of mine introduced me to the work of Jeffrey Yuen, and that really got me hooked, and I decided I needed to do acupuncture. And so I spent some time researching the different schools, the different lineages, and finally I decided I would enroll at UETC Paris, which is the Institute of Chinese Energetics and Traditional Acupuncture, which is actually one of the oldest schools of Chinese medicine in France. And after I finished my studies, I started my private practice. And since 2020, I also teach at a traditional acupuncture school in Normandy called Le Pôle du Thérapeute, founded by two former students of UATC and great friends, Astrid Tulek and Jose Herrero Cortes. Now, when people think of French acupuncture, really the first thing that the names that come to mind are Georges Soulier de Moran and perhaps Nguyen Van Guy. Now, with good reason, because Soulier de Moran really was the precursor, and Van Guy has written quite a number of books. He has trained a certain number of people, so he was quite well known. But I'm going to tell you about a different lineage, which starts, as far as the French branch is concerned, with Charles Lavillemery. Now, Charles Lavillemery was born in Périgueux, which is south of France. He started off by doing medical studies, which he gave up in order to help his father, who was a restorer of Egyptian antiquities for the Louvre Museum. We know that he went to China in 1932, that he spent some 5 years over there, that he discovered acupuncture, and that he had started to study it. Unfortunately, I was not able to find any information as to what type of acupuncture, who he's met, or any specifics. He came to France. Soon after that, World War II broke out. He became quite an important player in the resistance. And after the end of the war, in 1950s, he returned to Asia, and where he actively sought to get an initiation into Taoism. So he spent quite some time in Chinese temples and in pretty much all over Southeast Asia. He actually got initiated in Burma, within the Chinese community there. And also during this time, from 1950s to 1954, he spent his time going back and forth between Hong Kong and Taiwan, where he enrolled in two acupuncture institutes, and where he graduated from them in 1954. He was actually in Hong Kong. He met with Georges Soulier de Moran, who became a good friend. And in 1954, he was invited to partake into the World Acupuncture Congress that was held there. And thanks to him, other Frenchmen were able to come and study acupuncture there in Hong Kong, like Jean Schatz, André Faubert, and Jean-Louis Blard. He only published one book, which has long been out of print, unfortunately. The book is called Bioénergétique Chinoise, which he co-authored with André Durand here, who's known for his translations of the SOWEN, and Jean-François Borsarello. His sole disciple was Thierry Bollé. Now, obviously, La Villemerie has taught many people, but he only recognized Thierry Bollé as his sole disciple. Here's a picture of La Villemerie in Hong Kong at his graduation. And here's another picture of his at that World Congress I was telling you about. Now, Charles La Villemerie had three main teachers. The first one was Master Shen, who was the director of the acupuncture school in Hong Kong. Dr. Shen came all the way to France. This is a picture that was taken in France in order to bestow upon La Villemerie the title of official representative of his school in France and Europe. Another teacher of his was Léon Coq-Yuan, who was a 15th generation practitioner of Chinese medical doctors. He also taught La Villemerie, but also André Faubert, Jacques-André Lavier, and Dr. Van Buren. He's well known for having founded the North American School of Acupuncture in Vancouver, so he's influenced quite a number of Western acupuncturists. And finally, Master Wu Wei-ping of Taiwan, of Taipei, who was the founder and director of the acupuncture hospital in Taipei, of the acupuncture school in Taipei, and the president of the Chinese Acupuncture Society. He was a 16th generation practitioner, and he trained Jacques-André Lavier, André Faubert, but also J.R. Worsley and Dr. Van Buren. Jean-François Borsarello is also important in this lineage. He was a military doctor in the French Air Force. He discovered Chinese acupuncture, what was then Indochina. He collaborated on the bioénergétique chinoise of La Villemerie, and he also collaborated with other acupuncturists, Cantoni, Husson, Niboyer. He graduated his acupuncture studies from the Odawara Institute of Yoshio Manaka, but he also studied with Dr. Wu Wei-ping in Taipei. He wrote quite a number of books, which most of them are still in print today, and an autobiography called Mes combats pour l'acupuncture, which I highly, highly recommend you read if you understand French, because it's a hilarious book. You find out all sorts of different things about those first generation practitioners, the type of things they did. For example, I think Cantoni was trying to prove that acupuncture points existed by basically electrocuting people and being very annoyed with them because they complained. And you also find out that La Villemerie would not teach anyone unless they've mastered at least 2,000 Chinese characters. And many, many very, very funny stories. And finally, Thierry Bollé. Thierry started his acupuncture studies with Jean-François Borsarello and Thierry Gaurier. If I'm not mistaken, Thierry Gaurier also trained with Yoshio Manaka, and only later met with La Villemerie, who became his mentor. He studied with him for more than 15 years. Thierry founded IETC avec Jean-Louis Blard, and later on IEATC, the school I went to, on his own. Now, La Villemerie has asked Thierry not to publish any books. It must be a Taoist thing, I imagine. And Thierry didn't publish any books, although he has written many, many volumes on all aspects of acupuncture. Unfortunately, they are only available to the students of his school. I had the good fortune to meet Thierry. He was no longer teaching when I enrolled at UATC, but he would come every now and again and give some lectures, and we could talk to him. And he was a brilliant man, a very, very strong personality, a really brilliant man. Here you have a picture taken at the Museum of TCM, University of Yunnan, and you see Charles Ville-Méry here, and Thierry. They have their own little case over there. Okay, so let me say a few words about the characteristics of the lineage. So one important difference would be that we make no differentiation according to organ patterns. We go from the most encompassing level to the most specific. And we have some priorities in treatment. Now, like I said, so we do not differentiate in terms of the yin and yang of an organ, or qi and blood of an organ, or heat, cold, damp within an organ. What we do is that we associate general symptoms to different organs, be they physical, emotional, psychological. But what we really think is important concerning the Zhang Fu is the ratio of qi and blood within each Zhang and each Fu. And actually we use qi and blood, yin and yang, interchangeably here, right? Because one way in which yin and yang manifests through the body is through qi and blood. And so you can see here within the Zhang category, which is yin, you have organs which are more energetic, more qi related, more yang, and others which are more yin, more blood related. The same goes for the Fus. You've got very energetic ones and more blood oriented. And you can see that they are paired in such a way for so that the body may achieve balance, right? So you've got the most energetic, the youngest of the yin paired with the yinnest of the yang, right? Or the yinnest of the yin paired with the youngest of the yang, and so on and so forth. So there's a compensating mechanism between the organs, and this is important because you're going to have the same thing within the associated meridians, right? So for instance, if you take the liver, for example, now the liver is very yin, as you can see here, very blood oriented. What this means is that when you needle liver points, what you will mainly mobilize is the blood, not the qi. And the reverse is true for the gallbladder, which is very energetic. You're mainly going to mobilize the qi and not so much the blood. If you think of this in terms of river, the liver river would be very large, very deep, loads of water that's moving quite slowly, right? And gallbladder river would be more like a mountain stream, right? Very narrow, very shallow, lots of movement, loads of rippling and noise and energy going on. So if you want to imprint the movement in the body, you're not going to go to the liver for that. You're going to go to the gallbladder. But whereas if you need more replenishing, more nourishment, more volume, then you're going to go to the liver. So in our approach, when we say liver, we think, okay, very yin, blood, possibly prone to cold and prone to stagnation. Whereas for the gallbladder it would be very young, very loads of agitation, so heat, inflammation, right? And so we also have this notion, because these two all organs compensate each other, that the yang of the liver is actually provided by the gallbladder, and that the yin of the gallbladder is actually provided by the liver. So they really work in tandem. You can't separate the two. So for us, patterns like liver yang rising would be gallbladder, would fall into gallbladder territory. And so we have the same things related to the great meridians. For instance, here you've got Shaoyin, sorry, which is paired with Taiyang, right? So the youngest meridians of the yin are paired with the yinnest meridians of the yang. Lung and spleen are fairly balanced, and they're balanced by stomach and large intestine, whereas the liver and pericardium, the train, is balanced by Shaoyang. Right? So you can see that within these great meridians, you have a yin-yang compensation as well, right? So if you look here, for instance, if you look at the kidneys, you see that the Shaoyin is quite energetic. So the upward movement, right, because the yin meridians go up, will be quite easy to achieve. Whereas spleen, this is starting to be a bit more difficult. Liver, however, that's probably going to need assistance, right? So if you have blood stagnation in the legs, well, so you want the energy of the drain to move upwards, then you would perhaps palpate the foot drain. If you find sensitive points, especially around the joints, you would disperse those to open up the meridian, but that would probably not be enough. You would really have to also work on Shaoyang, the gallbladder, to draw its energy down in order to help push the yin up. So these systems, so they compensate within yin and yang. They also compensate as to their climatic qualities, right? So within the same meridian, you have two different meridians which pertain to different climatic qualities. If we think of their their related elements, right? So if you have, I don't know, too much humidity, too much dampness within the body, then you would diminish the function of the spleen and perhaps increase the function of the lungs. Now, if we say that Tai Yin is humidifying the body because the energy of the spleen, the earth impact, is much stronger than that of metal, which is drying. And this is, if this is not enough, then you'd work with the Yangming, which is supposed to compensate an excess of Tai-Yin, right? And within Yangming, you would probably go and work with the large intestine meridian, which is dryness because of its connection to the metal element, but also because of Yangming is dryness, right? So it's double dry. Now, there is one exception to what I've said here about the organs, and that is the kidneys. I mean, we do make a distinction between kidney yin and kidney yang, and that's mainly because we adhere to this idea that the kidney is really at the root of the energetic systems, and that kidney yin would give its yin to the other yin organs, and kidney yang will bestow its yang to the other yang organs. So we do have kidney yin and kidney yang treatments, but that is it. Okay, so another difference would be that we proceed from the most encompassing level to the most specific, ideally. So we use several systems in this lineage, yin-yang. I'm going to talk about this in a minute. The 3 burners, the 4 energies, the 5 elements, the 6 great meridians I've already talked about, the 6 layers, the Zangfu, and obviously all 5 meridian systems. Now, what we call the most encompassing level is the yin-yang level. And what we mean by that is really how is qi and blood distributed throughout the body. Left and right side, up and down, inside and outside. Because we think that if things aren't harmonious at this level, there's no point in going and looking for other more specific things to treat. It's like if you compare the body to a lake, for instance, right? And a lake which is in a certain environment, it's got different climatic factors acting upon it, etc., etc. And you suddenly find that there's a problem with the lake, perhaps that the water levels are going down, and you're trying to tweak the climate, make it rain more, perhaps try to diminish the heat. That could work, but what we're saying here, the yin yang level would be to look what's happening with the source of the lake. How's the glacier doing? Does the glacier have ice? Does the ice melt? And when it melts, does it flow all the way to the river, or is there some blockage on the way, right? This would be the yin yang level. Because if there's a problem with the source, anything you do down the road won't be long lasting, basically. So one way to assess this yin-yang level is through the pulse. We have in our lineage 6 stages of pulse taking, and the first 3 are related to this. So the first one, in which we see if the person is more yin or more yang, or how is yin and yang distributed on the left and the right side of the body. And then the second stage would be to look at how yin and yang is distributed within the surface of the body or the interior of the body. And the third, how yin and yang are distributed in the upper side of the body and the lower side of the body. And so we have what we call yin yang treatment, in which we use yin yang points. And what we mean by that, this is actually a one way in which we work with the 8 extras, right? Because most yin-yang points are actually opening points for the 8 extra meridians. We also use some other points that have quite a strong yin-yang connotation, like do 20, do 14, do 4, spleen 6, Ren 12, Ren 6, stomach 36, life 4, that sort of thing. And so we first do our treatments in order to make sure everything is balanced throughout the body. And we take the pulse. And if things have changed, then you can go and do other things. If not, you try to make sure things go back into place. Now, the second thing we look at are the 3 burners. All right, the 3 burners, because they are responsible for the production and the distribution of postnatal energies, right? There's loads of things happening within the 3 burners. Which means there are quite a number of things that could go wrong. And so you have to make sure that they're producing what they ought to be producing, and that they're communicating with each other, and that they're distributing all of this energy where it should be distributed. So again, the pulse indicates whether there are disharmonies here. We have a pulse taking, which you can see how yin yang is distributing in the upper burner, middle burner, lower burner, and whether the burners communicate with each other. And so if there are problems here, you do specific treatments in order to address them. And we use for that master points for the burners, be they local or distal. We also use front mu points and back shu points in order to enhance the production. And we also use passage points between the different burners in order to make sure that that the energy is flowing as it should. Now, once yin and yang is fine and the 3 burners are doing their job properly, then we have to determine which system we're going to work with, right? Now we're getting into the specifics. So ideally, when you're treating any type of pathology, you would first look at yin yang and the 3 burners. Then either you will have a symptoms that's going to point you towards a particular meridian or some energy that's deficient and that needs help. Like, having great pains in the chest as if someone's stabbing you would be a full pericardium blow, for instance. But if you don't have such specific symptoms that point you towards a certain meridian or in particular, then you can choose your system based on the location of the problem. For example, if the problem is on the surface of the body, which includes the skin, superficial muscles, the head, the arms and the legs, well, then you work with superficial structures, meaning the meridians, and within the meridian systems, you'd have the sinews, you have the primary meridians, perhaps the 8 extras, the great meridians, the 3 young layers, the longitudinal laws, the 5 elements, or even Wei Qi, in order to affect the surface. Now, if you want to affect the interior, then you have the 3 burners, the Zhang Fu, the Yin, the Shui, the Yuan energies, the 5 elements, 8 extras, Chong Mai, mainly curious bowels, the great meridians, 3 Yin layers, right? Now, if the problem is with things not being able to move out or to move in, then you can use the 5 elements. If you think of the elements in a cross, right, with the earth in the middle, wood would exteriorize things, make things go out, and metal would make things go in. You could use the divergence, the transversal laws, Chongmai Daimai couple, Zhang Fu as the food drains the Zhang, the different layers, Yang Ming and Tai. You could have a problem with up and down movement. That's a bit the example I gave earlier with the blood stagnation in the legs, for instance. You would use the great meridians for that to help the body bring things up or down, but also Yin Wei Mai and Yang Wei Mai. For emotional, psychological issues, you would use the 5 elements, the 8 extra vessels, the 3 burners, the great meridians, the Wushen. And I remember of a case of an old lady who came because she thought she was having sciatica problems. And after speaking with her and asking her all sorts of questions, she, she used to be completely autonomous, do everything on her own. And then she had a doctor's appointment. Her thyroid she had just only to check her thyroid, and so she called a taxi, and the taxi was this huge car, which for some reason really scared her, made her really uncomfortable. She was very frightened by it, so she started to feel pain while she was in the taxi. Then she got off, she went and to do her test, and they had her swallow a pill in order to monitor what was going on over there, but the pill got stuck in her throat for about 15 minutes, and that was a bit traumatic. And then when she went back home again, the same scary car was there waiting for her, and ever since that moment she was no longer able to move. Right? She could not even walk. She could not do anything anymore. And so, after talking to her, I found out that she was diagnosed fibromyalgia 40 years earlier, because she said, well, this pain reminds me of what I've lived 40 years ago. And so, I was thinking, okay, well, there was the fear and the shock of the experience, that sensation that things got stuck in her throat, which she still had. And so I did a Shao Yin treatment, points on the kidneys and the heart, Ren 23, and that was it. From that moment on, she was up and about. Started walking again, doing everything she usually did. So see, the problem was actually emotional, right? So let me give you another example. let's say you have a backache. Because if you look at all of this, you have many things to choose from. How do you choose between all of these systems? So let's assume you have a patient who comes for a backache, but he also has constipation, and perhaps the lack of yin, the lower burner, and some GERD maybe. And you take the pulse and you see that the lower and the middle burner are not communicating, right? And so you do the appropriate treatment to have things communicate, bring more yin to the lower burner. The person passes their stools, and lo and behold, no more backache, right? And this without you putting any needles on the back or on the bladder meridian or whatever. Let's say you have another patient who also comes for backache, but this time this is a father who had just had his first child. This is a true case, by the way. And so ever since his newborn, he has horrible backache, so much so that he cannot even hold his own baby. So then I would go for 8 extra, for the 8 extras, right? I think that the treatment was really ridiculously simple, like SI3 and bladder 62. And that got rid of the problem. Let's say perhaps another patient would come, okay, I also have backache, but then you find out he has regular bouts of sciatica, and that he has sleep problems, and that he has perhaps some urinary issues, and then you go, they're very tired, and you go, oh, maybe I should go and work on the water element to strengthen the kidneys, right? Or maybe another person comes again with back problems, but they also have some emotional stuff going on, some anxiety, they sweat easily, and then you do So-Wen treatment. So see, there is no recipe for how you treat something. You just look at the pulse, you try to bring things in harmony, and then based on what the person is telling you, what's going on in their lives, you choose one system in particular. Okay, so finally, our treatment priorities. The first one would be paradox. Now, what is this? The paradox is when you talk to your patient and you get an idea about what's going on, and then you take the pulse, and the pulse is wildly different. I mean, it's those situations, you take the pulse, you go, huh? What? No, that can't be wrong. That can't be right, you know? So we call that a paradox, and we have a special treatment for that. And then you do the treatment, retake the pulse, and usually the pulse changes quite a bit after that, if the assessment is right. Now, the second treatment priority would be, if there's a pathogenic factors, get rid of it first, then do anything else. And thirdly, if there's deficiency, deal with the deficiency. And if there's general deficiency, first deal with yin deficiency. Why? Because yin nourishes yang. And so if you have general deficiency and you increase the yang, that's going to slowly eat away at the yin. And so you get even more false yang and less yin. So that's not a situation you want to be in. So there. Thank you for listening, and have a great Congress.